Endometrial cancer is cancer in the lining of the uterus itself. It is probably the most common type of malignancy. Um, there is one that's caused by a high exposure to estrogen, um, and then there's one that's a high grade serous or clear cell carcinoma. Any uterine bleeding in a postmenopausal, after they've gone through menopause, patient is going to require further evaluation. Um, and typically, this is going to be with the use of a biopsy. Symptoms of or endometrial cancer, and sometimes they'll call it uterine cancer, but endometrial cancer is abnormal uterine bleeding following menopause, abdominal pain in the more advanced stages, not really symptomatic early usually. It causes ulcerations in the uterus, and as the ulcerations damage the tissue, then blood vessels start to become damaged, and that causes spotting or bleeding. Um, and so that's usually the first signs and symptoms they'll see of the disease. Diagnosis, endometrial biopsy, DNC, looking at biopsy tissue, and transvaginal ultrasound. Usually, they do a biopsy on any female over or during postmenopausal to look for this particular problem. Staging, usually, if it is an actual true showing indications of a cancer or near cancer, then they're probably going to do a total abdominal hysterectomy and removal of the tubes in the ovaries, and maybe even lymph node biopsy in order to look at how far the disease has progressed. In the early stages, treatment's going to be surgery, and when it gets to a more advanced stage, then they'll have to do radiation. With or without chemotherapy, depending on how evolved it has gotten. They may actually do a radiation implant, and that would be done as an inpatient procedure. The biggest risk of recurrency of the cancer is within 3 years of diagnosis. Um, and usually for the first 3 to 6 months, they'll do a little closer follow up of the patients. Now we move into the obstetrical side of the material. Uh, Complications in pregnancy can occur at any point during pregnancy. Um, and you have to look at the prenatal care, and you have to look at patient education. A lot of things are included in that. Um, and complications can be anything from something very minor to something very life threatening to either the fetus or the mother. Prenatal testing can sometimes show some genetic and chromosomal abnormalities, things like amniocentesis and biopsy that we can, with that, look at sampling of the chorionic villi, and with that, kind of get some really early indicators of a problem. Um, and it is usually doing this one on placental tissue. Um, Doppler ultrasound is another thing that they can do, getting a kind of a 3D image of the fetus to get a better visual look at it. Ultrasounds are basically high frequency sound waves that reflect off the tissue. It has different densities, and that helps you to see um, different images based upon the densities. Um, you can do these basically at current time, which means if fetus is moving, you're seeing movement, you're seeing everything. Um, we do pelvic ultrasounds for only the pelvic structures and pelvic reasons. Um, it is not radiating. There's no radiation involved. It is pretty painless. Um, but it will give us a pretty good idea if there's any fetal abnormalities, or looking at how long this pregnancy has existed. Sometimes there's confusion of what the dates are. So we'll get a fetal age, fetal size, look at the position sometimes as you get later on into pregnancy. Um, and looking at the placenta, make sure that it looks healthy. In some cases, depending on your equipment, they can do a 3D ultrasound, which is nice from a photographing picture category. One of the big problems that pregnant patients will have is nausea and vomiting. That in of itself, other than being maybe miserable to them, it's really not typically a real significant problem. About 80% of pregnancies that will noticed. It usually goes away in somewhere between 12 and 16 weeks or prior to that. Um, Symptoms can occur anytime during the day. And a lot of times it's not really even not just morning sickness, it's sickness at different points during the day. Um, there's only about a 1% occurrence usually after the 20th week that women will notice this. If it gets really severe where they're losing weight or they're really getting beyond that just simple morning sickness, then we usually label it as hyperemesis gravidarum. But that's a less than 1% of the patients will have that, and usually it's you can determine real easy which patients that happens to be. The reasons for morning sickness are a lot of times hormonal changes that estrogen change that they get with pregnancy. Also, the HCG is evolving, changing, increasing. So it's a very early hormone. Um, and then emotions in general can also trigger an episode. Um, if they have normally have GI upset things, that may be another factor that may help to increase it. Um, a lot of times it's short, it doesn't last long, or doesn't last long in time. Um, but if they get dehydrated, you have to. It becomes a little more concerning then. But you treat in that case the dehydration. The usual treatment is just to eat smaller amounts of food, keep hydrated, rest. Some patients may, if they like ginger, may actually do better with ginger or with the wristbands, but that's not always something that is prescribed necessarily. Uh, the vitamins, prenatal vitamins should cover them. They've got vitamins B6 and 1, but that's not something I've seen specifically recommended to patients. But basically, it's just a symptom-based thing. We know they're pregnant, then they start having symptoms. The other things is avoid foods or smells or things that would normally bother them. Um, Medication, usually they prefer to avoid if at all possible, and that's any medication. It usually goes away on its own, but if it became more severe, then you start looking at and evaluating based upon that. Hyperemesis gravidarum, as I mentioned, it's severe nausea and vomiting. Um, in this case, it's one where they're starting to lose several pounds. Um, it doesn't end quickly, and it's more severe when it occurs. So they'll have weight loss greater than 10% of their weight. They'll get dehydrated because they can't keep anything down, and then the fluid and electrolytes balances are become a question. It may again be because of the hormone fluctuations, um, and they may not be able to eat food or drink anything, and so this is one that we treat a little bit more seriously. Symptoms are severe episodes of vomiting and nausea, weight loss, dehydration, can't keep anything down. Um, the urine gets altered. They have hemoconcentrated blood, mainly because they're dehydrated, and then their white cell count will elevate. If it's not treated, then the fluid and electrolyte balance can be a problem because it's imbalancing both the fetus and the mother. They'll look at liver enzymes, thyroid labs, um, and be a little more aggressive in the treatment of this one. In majority of cases, when it gets to this extent, they're going to put them in the hospital. They're going to give them IV fluids and the electrolytes, getting those replaced quickly. Sometimes that will resolve a lot of the symptoms, but they may give them some medications to stop the vomiting. Um, Depends upon how severe it is, to what extent they go in treatment. Prognosis is usually good. They get them calmed down, and this usually phases out in early pregnancy too. I mentioned before that abortion term is used in to define miscarriage, but there's also other variations in what's defined as abortion, and we'll look at those too. But it is something that happens naturally, the loss of a fetus before the 20th week, and it happens in about 10 to 20% of pregnancies in this way. And a spontaneous abortion means they become pregnant and then they have a loss of the pregnancy. So it's not something it's intentional, it's just something that happens. Uh, it's felt that probably the biggest majority of these are because of abnormal chromosomes of the fetus. Um, but there's also some um, physical problems that may be higher risk, things like um, lupus or clotting disorders. Um, and simple things or travel or things like that really don't cause any of this. And that's always a question: should they travel? Should they not travel? Um, now, this may also be called. Um, you may also see abortions referred to as a missed abortion. That's when there's a miscarriage, there's a fetal loss, but there's no tissue passed. And then an incomplete abortion is one where part of the tissue is passed and part of it has not. And then complete is one where they have a fetal loss and all of the tissue has been expelled. So the plus with that one is they're probably not going to need a D&C after that one. Symptoms of spontaneous abortion or miscarriage. Uh, Usually they start with bleeding to some extent, and if it gets more excessive, then you're more suspicious of this. Um, they'll develop a rapid pulse, low blood pressure, mainly because of the tissue loss and blood loss, rather. Cramping, positive pregnancy tests, but they're bleeding, which typically you don't see as going together. Um, they'll have cramping. Um, they may have bleeding of a mild amount or a more extensive amount. Um, Sometimes, whenever they look at the cervix, they may see tissue there, but quite often they don't. Um, and there's another concern if they go through a lot of this and don't see tissue, but we'll get to that one just a little bit later.